Have you ever been sitting in a quiet room, a soft ringing, buzzing, or hissing suddenly appears? Like a secret frequency only you can hear? If that's you, you're not alone. That strange sound, tinnitus, is not just an annoyance for many people over 50. Sometimes it's your body's whisper. Please pay attention. Tonight, we'll walk through 7 causes doctors watch closely, how to tell the harmless from the important, and the small daily steps that can bring peace back to your ears. We'll keep the language friendly, the tips practical, and the tone calm, so you leave with hope, not fear. 1. The volume of silence. Early hearing changes. Meet Tom, a retired teacher from Ohio. After mowing the lawn, a high hiss lingered. He thought it was the mower. It was actually his first clue of early hearing loss. Tiny hair cells in the inner ear can wear down with age or loud sound. When the ear sends fewer signals, the brain sometimes fills in the silence with a phantom tone, tinnitus. Everyday signs to notice. You ask people to repeat themselves, especially in restaurants. You hear voices but miss the words, especially women's or children's voices. The TV volume slowly creeps up and stays there. At-home checks, gentle and simple. Do a whisper test with a family member from the next room. Try a reputable online hearing screen with good headphones in a quiet room. Compare your left and right ears. Does one seem weaker? What helps right away? Book a hearing test. Even mild loss can make tinnitus louder. Consider modern hearing aids if recommended. They reduce listening strain, bring authentic sound back in, and often soften the ringing. Turn down loud headphones. Aim for below 60%. And wear ear protection for yard work, power tools, or concerts. Tom's update. With hearing support and better sound habits, his hiss faded into background, making his conversations easy again. Mythbuster, if I protect my ears now, it won't matter because damage is done. Not true. Protecting your ears today prevents tomorrow's damage and can reduce tinnitus intensity. 2. The pulse you can hear, circulation and blood pressure. Margaret from Yorkshire noticed a whooshing in time with her heartbeat after climbing stairs. That's pulsal tinnitus. Doctors pay attention because it can reflect blood flow changes. Common culprits: higher blood pressure or big swings in pressure, anemia, low red blood cells, or thyroid shifts, stiffer arteries with age or cholesterol changes. Simple checks this week. Track your blood pressure morning and evening for 7 days. Notice patterns. Does the sound grow louder when lying down, bending over, or after salty meals? Note breathlessness, palpitations, headaches, or ankle swelling. These clues help your clinician. Gentle actions that help circulation. 20 to 30 minutes of walking most days. A heart-friendly plate. Oats or whole grains, leafy greens, beetroot, olive oil, beans, and fish like salmon or sardines. Hydrate steadily through the day. Sip, don't chug. Ask your GP about anemia and thyroid tests if the pulsing persists. The river-like whoosh settled when Margaret's blood pressure was managed and her salt intake eased. Red flag note. A brand new one-sided pulsing sound warrants prompt medical attention. 3. The unwanted side effect, medication and ear sensitivity. Nora, a retired nurse in Melbourne, developed a sharp whistle after starting a new arthritis medicine. Some drugs, certain painkillers, antibiotics, chemotherapy agents, even high-dose aspirin, can irritate the auditory pathway in sensitive people. Others can dry the inner ear or tweak circulation. Your move. Don't stop medication on your own. Tell your doctor or pharmacist about the new noise. Ask, are there alternatives, a lower dose, or a different schedule? Keep a ringing diary for 2 weeks. Date, time, new meds, caffeine, stress, sleep, and what you notice. Patterns make fixes faster. Practical pharmacy tips. Review your complete medication list once a year, even over-the-counter pain relievers and herbal products. If you start a new medicine, remind yourself to check in about changes in sound, sleep, or balance. Nora's GP adjusted her regimen. The whistle softened to a distant hum within days. 4. The block signal. Earwax, sinus pressure in the hidden, hollow ear. Sometimes the fix is blessedly simple. John, 68, from Florida, had a steady indoor buzz. His GP removed a deep wax plug, and the buzz vanished on the spot. What to avoid? Cotton swabs. These push wax deeper and can scratch the canal. Ear candles. Unsafe and ineffective. What to try? Warm olive oil or pharmacy drops for a few nights to soften wax. Professional cleaning is recommended if you wear hearing aids or build up wax quickly. If you feel facial pressure, popping, ears, or seasonal allergies, try saline sprays, steam inhalation, antihistamines, or prescribed allergy care. Extra tip for the hollow ear feeling. Chew slowly. Relax your jaw and shoulders and avoid clenching when congested. Tight jaws can amplify internal sounds. Mythbuster: if it's wax, I'll feel pain. Not always. Wax often causes muffled hearing and makes internal body sounds more noticeable, like you're breathing or a low hum. 5. The tight jaw and stiff neck, TMJ and cervical tension. Priya, a 62-year-old Londoner. Clench your teeth at night. Each stressful week, her jaw tightened, her neck stiffened, and her tinnitus flared. The jaw joint, TMJ, sits close to the ear canal, and tight muscles can change how your brain perceives sound. Clues: it's jaw/neck related. Jaw clicking, morning jaw soreness, temple headaches. Neck stiffness, rounded shoulders, screen time marathons. Tinnitus that changes when you clench your teeth or turn your head. Gentle relief routine, evenings 10 minutes. Warm compress to the jaw and neck. Jaw glides, slow open close side to side, 5 each. Tongue to palate breathing. Use the tip of your tongue just behind your front teeth and breathe quietly for 1 minute. Posture check. Screens at eye level. Bring your phone to your face. No turtleneck. When to get extra help. A dentist-made night guard if you grind. A physiotherapist for neck mobility and gentle strengthening. With a night guard, posture tweaks, and short stretches, Priya's ringing move from front row to back row. Still there, but easy to ignore. 6. The nervous system's Megaphone stress, sleep, and sound therapy. Sophie from London cared for her mother through the night. On little sleep, her tinnitus roared. Stress and poor sleep sensitize the brain's alarm system, turning up background signals, calming the circuits. Breathing reset. 4 seconds in, 6 seconds out. 5 rounds at bedtime and during flare-ups. Sound therapy at night. A bedside fan, soft nature sounds, or gentle pink noise. You're not drowning tinnitus. You're giving the brain a neutral sound to rest on so it learns to ignore the ringing. Wind down routine. 30 minutes dim lights, light stretch, a few pages of a book, no upsetting news, and screens off. Caffeine and alcohol audit. Many do fine with morning coffee, but react to afternoon caffeine or late evening wine. Test a 2-week trial. Mornings only for caffeine, and alcohol with dinner or earlier, or skip and see. Mindset care. Brief coaching or CBT-based strategies can help your brain tag the sound as safe and boring, which turns the volume down over time. A simple sleep soundscape menu. Ocean waves, gentle rain, rustling leaves, soft brown/pink noise. Pick one. Set to low volume and let it play for 45 to 60 minutes. Sophie's combination, breath work, a calmer bedtime, and ocean sounds, made nights quiet enough for real rest. 7. Food, nutrients, and everyday habits. Giving ears what they need. Your inner ears rely on healthy blood flow and well-fed nerves. Some people with tinnitus are low in B12, magnesium, or zinc, especially if they eat little animal protein, take metformin, or have digestive issues. Food first foundation, easy swaps. For breakfast, eggs, Greek yogurt with berries, nuts, or porridge with ground flax and pumpkin seeds. Lunch, leafy greens, beans or lentils, avocado, whole grains. Dinner, fish 1 to 2 times weekly, salmon, sardines, plus colorful veg and olive oil. Snacks, a small handful of nuts or pumpkin seeds. fruit with yogurt. Tiny tweaks that help. Hydration. Pale yellow urine is about right. Caffeine window. Mornings only for 2 weeks. Reassess your sleep. Salt awareness. Restaurant and packaged foods add up quickly. Pair salty meals with extra water and attend a 20-minute walk. Discuss supplements with your clinician if your diet is limited or labs suggest a gap. Bill and Sydney swapped nightly crisps for pumpkin seeds and added a 20-minute sunset walk. His sleep improved and the ringing lost its sharp edge. When it's a red flag, don't wait. Most tinnitus is manageable, but please seek care promptly if any of the following appear. It's only in one ear. It pulses with your heartbeat. You notice sudden hearing loss, especially within 72 hours. It comes with dizziness, facial weakness, severe headache, or balance trouble. Start with an audiologist and your GP. An ENT specialist can guide the next steps. Early care protects precious hearing and rules out rare but treatable causes. A gentle 7-day, calm ears plan. Day 1, clarity. Book a hearing test. Start a simple tinnitus diary. Note sleep, stress, caffeine, salt, new meds, and when the sound is louder or softer. Day 2, protect. Lower headphone volume. Set a 20 to 30-minute daily walk. Day 3, sleep. Create an evening wind down, 30 minutes screen-free. Pick one soundscape, rain, ocean, or pink noise. Day 4, unclench. Warm compress the jaw/neck. 5-minute stretch routine. Screens at eye level. Day 5, plate. Oats at breakfast, leafy salad at lunch, fish or beans at dinner. Hydrate steadily. Day 6, audit. Caffeine mornings only. Alcohol earlier or skip. Notice changes. Day 7, review. Which 2 habits help most? Lock them in for the next 2 weeks. Doctor visit checklist. Bring this to your appointment. When did the sound start? Sudden or gradual? One ear or both? Is it constant, intermittent, or pulsing with your heartbeat? What makes it better or worse? Caffeine, stress, lying down, exercise? Any ear fullness, pain, dizziness, balance issues, or new headaches? Full medication and supplement list, including over-the-counter. Your home blood pressure readings for 1 week. Your tinnitus diary. Even a few days helps. Lightning Q&A. Quick reassurance. Will this last forever? For many, no. With better sleep, sound therapy, hearing support, and stress care, the brain often turns it down. Should I avoid all noise? Avoid loud noise, but gentle everyday sound helps your brain tune tinnitus out. Is silence good? Deep silence can make tinnitus seem louder. Soft background sound can be more comfortable. Do I need expensive gadgets? Not usually. Start with habits, hearing checks, and simple soundscapes. Add tools only if needed. That strange sound in your ears doesn't define you. For many, it's a kind nudge towards steadier sleep, a heart-friendlier plate, jaw and neck care, calmer days, and the simple joy of protecting your hearing. Your brain can learn to dial it down with small, consistent steps. If you live with tinnitus, what has helped you? Sound therapy, breath work, a hearing aid, posture, or something else? Share below. Your story may be someone's turning point tonight. Please like, subscribe, and share if this brought you clarity or comfort. You deserve calm, quiet moments that are closer than you think.